Dermal fillers are inert substances that can be injected underneath the skin to provide volume. There are many different types of dermal fillers. Most of them belong to the class called hyaluronic acids. Juvederm is by far the most popular, but even within the Juvederm family, there are different thicknesses and viscosities that the physician will use. So this is something that your physician will decide for you, and depending on where you need to inject the fillers, he or she will decide to use the appropriate type of filler. There's another type of filler by the name of Radiesse that I really like. It's not a hyaluronic acid filler. It's a suspension of tiny calcium crystals or tiny calcium balls suspended in a gel. And this tends to last a little bit longer and gives you a little bit more lift. It has a higher G prime, gives you a little bit more lift for what you put in. I really like it for the lower face. The hallmarks of aging in the face are the 3 Ds of aging. That's descent, deflation, and dyspigmentation. Filler is the perfect thing to address the first two, the descent and the deflation. So the hallmark of a youthful face is having a wide mid-face that tapers down into the lower third of the face. When you start having descent and deflation, you start getting sagging jowls, and the triangle almost reverses itself. With the filler, it's perfect for replenishing the volume along the zygomatic arch or the mid-face, along the jawline, and it can really make a nice difference in the proportions of the face. Filler can also be used to fill up the nasolabial lines, underneath the eyes to address sort of sagging bags underneath the eyes, and even in the temple area that you can actually get a depression when you age. And of course, famously, we can use filler to plump up your lips, because as we age, the lips tend to thin out a little bit. Things have changed a lot in the last few years. Initially, when fillers first came out, as physicians, we tended to be line chasers. A patient would come in and tell us, oh, I've got these lines here that I don't like, and we would just chase those lines and would remove those lines. Gradually, I think the thinking has changed a little bit, and what we tend to do is we're thinking more about proportion. So a lot of times, instead of just going in and filling a line, we take a look at the face in its entirety and realize, okay, well, we need a little bit more here, a little bit more there, a little bit along the jawline, just to strengthen it. And by putting a little bit of filler into a whole bunch of different areas, you can actually make a nice difference, and the patient can look a lot more refreshed and look a lot more well rested, even though they may have 1 or 2 lines that are still there. I think the direction in the next few years is to move away from just being line chasers and to look at the whole face in its entirety. We can combine a little bit of technical skill, combine a little bit of artistry, and a bit of know-how to really give the patient the best result. The pain from a dermal filler is really negligible. Most of the fillers these days has xylocaine mixed in together with it, and the treatment is really quite comfortable. Overwhelmingly, dermal fillers are safe. The most common complications are bruising at the site of injection, especially around the mouth, or a little bit of lumpiness around the site of injection. These can be easily managed in the office and without any pain. There's a very, very rare but significant vascular complication that all physicians are worried about. Sometimes a little bit of filler can get inside the artery and compromise the blood flow. This is something that you should be discussing with your physician before the treatment. Depending on the area that you're injecting it into and the type of product that you're putting in, it can last anywhere between 6 and 8 months for the area around the mouth, and 12 to 18 months around the cheek. If you're putting it into an area that has a lot of movement, it'll break down more quickly. And if you're putting in a product that's a little bit softer and runnier, it'll also break down more quickly.